Senior Consultant Gynae Laparoscopic Surgeon at Cloudnine Hospitals, Sahakaranagar. The topic I am going to talk is fibroids. So fibroids are small swellings or the lumps that grow from the muscle of the womb or the fibrous tissue of the uterus. They vary in sizes, like small seedling fibroids, size of a peanut, to as big as a size of a watermelon. Do all women diagnosed with fibroids need to be treated? No. So if the patient is having symptoms of excessive uterine bleeding, that is, if the bleeding is heavier, passing clots, and it lasts for a longer duration, and also if there is associated anemia, if the hemoglobin is dropping down, then only it requires treatment. Majority of the women don't need any treatment as they are asymptomatic. Only few percentage of the women may have the symptoms of excessive uterine bleeding, pain, and also the pressure symptoms. Now, these fibroids are located in the uterus in various sites. Majority of them are in the wall of the uterus, that is the body of the uterus, and some are in the cavity of the uterus and some are attached to the wall of the uterus, and these are called as subserous fibroids. So subserous fibroid which are attached to the wall usually don't cause any symptoms except the pressure symptoms. The pressure symptoms, like depending if it is lower down, then it can cause pressure on the urinary bladder, therefore you may have increased frequency or you may have incomplete emptying bladder sensation. If it is located on the posterior wall of the uterus, then it may cause pressure on the rectum, that is on the bowel, so you may have constipation symptoms. The treatment or the diagnosis depends on the clinical examination that the uterus is. So some patients may have infertility problem because of the fibroids which are located in the wall of the uterus or inside the cavity of the uterus can block the tubes also and also may hamper the implantation of the embryo. So in that case, then the patient needs treatment. So the diagnosis is mainly based on the clinical examination, the ultrasound, and if the patient has got multiple fibroids and needs surgery, then MRI is the best imaging modality. Coming to the treatment, basically if the patient is symptomatic, then patient needs to be treated in terms of if it's affecting her quality of life, especially if there is abnormal uterine bleeding or excessive pain in her lower abdomen during her cycles, or if the patient has got history of infertility, or if there is sudden increase in the size of the fibroid, and also if she is over the age of 45 to 50, which sudden increase in the size may indicate that there is something abnormality inside the fibroid, which is seen in 1 to 2% of the cases. So the treatment based is mainly the medical management, that is to control the excessive uterine flow is treated by medically with the medications initially, and there is other technique or the coil that is in the market called Mirena coil. If the cavity is smaller and fibroids are smaller, then Mirena coil helps in control of the abnormal uterine bleeding. That is, and also it helps to shrink the size of the fibroids to some extent. There are other ways to control the bleeding, like the injections. One is the Depo-Provera that can be taken every 3 months to control the flow, or for the shrinking of the fibroid is the GnRH agonist injections. But the only side effect is that it can cause artificial menopause. So initially it should be tried with medications if it helps to control the flow. However, if the size is bigger, that is if it is more than 5 to 6 centimeters, definitely needs removal. However, if it is between 3 to 4 centimeters, then patient needs to be told to have a scan after 6 months to a year to see that if the fibroid is increasing in size. If the fibroid is larger and is causing heavy menstrual bleeding or the pain or the pressure symptoms on the bladder or the ureter or on the rectum, then surgery is one modality that can be advised. In younger women where she needs to conserve her fertility, then myomectomy is recommended. So myomectomy, fibroids are called as a myoma, and therefore the removal of this myoma is called as myomectomy. It can be done as laparoscopically, and also if it is a large fibroid, then can be advised as open technique. And here only the fibroid is removed and the uterus is conserved for future fertility. However, if the patient has completed her family and she is nearing or above the age of 40 years, then the treatment that is recommended is the hysterectomy with conservation of ovaries depending on the age of the patient. And there is other treatment which is newer technique called as uterine artery embolization, and it is done by the interventional radiologist, where the dye is pushed through the one of the blood vessel in the thigh region to block the uterine vessels, and thus the blood supply to the fibroid is blocked, and thus helps in shrinking of the fibroid. But again, the success rate depends on the location of the fibroid and the size of the fibroid, and thus that is the other non-invasive technique that is in the literature now, and also routinely done in major cities. So fibroids are the benign structures, they are non-cancerous, and therefore women can live with it, and it's very common in Indian women. So women who have fibroids and who want advice or any query regarding the fibroid treatment can visit our unit. I am available between 10 to 4 p.m. from Monday to Saturday, so that we can discuss about the treatment. Thank you.